Almost 2 years ago, Kathy Bruce's life was in jeopardy when one of her heart valves was failing. Fortunately, an innovative, minimally invasive procedure saved her life. She joins me today along with Dr. Farhouch Berdjis, a pediatric cardiologist at Children's Hospital of Orange County and the director of the Adult Congenital Heart Program at St. Joseph's Hospital. They're here to discuss the device that saved Kathy's life. Welcome.
Thank you, Larry.
So what is congenital heart disease?
That's a good question, Larry. A congenital heart disease means that a baby was born with a heart problem, and it ranges from something very simple, a small hole in the heart, to something very dramatic, a missing artery, a missing valve, even a missing chamber that needs immediate surgery.
Now, the surgery started how many years ago?
A long time ago. So in the mid-40s, the first blue baby operation was performed in a child with tetralogy of Fallot, which is exactly the heart disease that Kathy was born with.
And so these patients are now some 40s, 50s, and 60 years old now, some of these?
That's correct. I saw a 70-year-old gentleman with tetralogy of Fallot recently, and these patients are surviving, thank God, due to the very good work of the surgeons involved.
Now, how many adults have congenital heart disease today in this country?
The statistics vary quite a bit. It's between 500,000 to 1 million. So it's very clear there's a minimum of 500,000 adults who had surgery or surgeries as children.
Now, Kathleen, you had your first surgery at what age?
At age 2.
At 2, and that was, you were about 6 decades ago?
Yes.
Something like that?
Yes.
Yeah. And how many surgeries have you had altogether?
I've had 4 open heart surgeries and several less invasive surgeries.
And a pacemaker, too.
And a pacemaker, yes.
And I saw you maybe 10 years ago, and you were doing fine for quite a while. And then a couple of years ago, things changed. What happened? What was changing?
I just had an inability to be able to do normal things, like climbing stairs was almost impossible. Walking any length of distance was difficult. Very short of breath, very lack of energy, a lot of swelling from fluid retention.
You were miserable in a way.
I was miserable, yes.
And we kept adjusting your medications, and they worked for a while, and then after a while, nothing was working, right?
Correct.
Yeah. And then I asked Dr. Berdjis to see her. What did you find, Farhouch, when you examined?
So I remember seeing the first time at the hospital. I think you were hospitalized for heart failure.
Right.
Your legs were rather swollen because of the fluid that your body couldn't normally basically get rid of. And by examination, it was clear that your heart valve, one of your heart valves, was not working at all.
And in her, this valve which was on the right side of the heart, correct?
That's correct, Larry. Yeah, that was on the right side of the heart, and the valve that you worry about in any tetralogy patients is the pulmonary valve. That's the valve between the right pumping chamber and the lung artery. And
most adults, the valves are more, when they deteriorate, it's more on the left side.
That is correct. So typically you see patients that have left-sided aortic valve problems. In the pediatric patients, or the patients who have pediatric diseases, children's diseases, that's typically the pulmonary valve, the lung valve.
Now in her, you thought, what were your recommendations to her?
Well, discussing the situation with you and with Kathleen and her husband, my impression was that your lung valve was not working at all, and actually this valve was placed some good 10, 12 years before the procedure, and that's the typical expectation. The valve you had placed before, they last maybe 7 to 10 years, and then they literally fall apart, and so that was my assessment and my impression at that time.
And the one 10 years before was put with open heart surgery. They opened your chest and put that in, correct?
Yes, a new aortic and a new pulmonary.
So this time, either you had to open the chest again for open heart surgery number 5, or
do something else.
Do something else.
So fortunately, a new technology arrived just maybe 6 to 12 months before we met for the first time. And that technology is a catheter-based valve.
And this is her valve right
and
here?
this is a prototype of the valve. The beauty of this valve is that you can place it through a catheter, which is a tube, and that tube is inserted through the vein in the groin. So it's not surgery, there's no cutting involved, there are no stitches that you have to place or you have to remove. It's a much less invasive procedure.
Yeah, much
Yes.
less. So what did you think her chance of success doing it this way versus having another open heart surgery?
Well, the procedure is challenging, and it was the early days of the procedure, at least in the United States. And I thought there was a very good chance of having success, but there's a lot of work involved in this procedure. It's not a simple, straightforward 20-minute thing.
Yeah, and I think we had surgeons, open heart surgeons, see you, and they thought that the open heart surgery was going to be very, very challenging, number 4. So it was kind of a blessing
You're right.
that he came
And
along.
very dangerous.
Yeah.
And very dangerous. The risk of heart surgery increases the more previous open heart surgeries you had, and the risk of dying, not just the recovery and having pain and all that, but the risk of dying increases significantly every time a surgeon has to go back and open the chest.
It was amazing. Can you show us how this valve works
Happy
and what
to.
it's made of?
So this valve is obtained from the cow. It's from the jugular vein, which is the neck vein of the cow. And the reason behind that is the following. The cow has to lift the head and tilt the head up and down many times during the day. And therefore, that valve is a very, very sturdy valve.
And can I see how, can you pick it up and see how big it is?
So this is about the original size of the valve. It's almost an inch in width. And the way it works is that the valve is taken out with a sleeve of vein, and then that whole piece, the valve and the vein itself, are put into a stent. When you look at this model, the metal part is a so-called stent. These are metal struts that you can open, and you can squeeze them together, and then you can open them up with a balloon catheter again. So the stent is opened, and then the valve is dropped into the stent, and there are stitches that fix the valve with a sleeve to the stent. So it's stitched on both ends, and the greenish stitches tell you which direction to go. It would be very bad to place it the wrong way.
The wrong way here.
That would be a bad thing to do. So to help you with that, they have these blue-greenish stitches, and you know then you have to place it that way.
And obviously you place it the right direction in her, because
Yes.
she's doing pretty good.
There's a careful mechanism. There's a double and triple check in the cath lab where 2-3 individuals make sure it's put in the correct way.
Now, do they come in different sizes?
The valve itself comes in one size, but you have different balloon catheters that allow you to have a smaller end size, so to speak, and a larger size.
And then the recovery from that is how quick?
Kathy, do you remember how long you were in the hospital after the procedure and how long it took you to recover?
I wasn't in the hospital that much longer afterwards, and within days I totally could breathe better, and within a month I was a new woman. Yeah, for sure.
Yeah. So typically it's just an overnight stay, and again, you don't have to remove any stitches. You take it easy for about 1 week. You have to make sure your leg is nice and easy.
Right.
But after a week, patients, whether they're children or adults, can go back. They can run on a treadmill if they like. They can ride a bicycle. They can go swimming and just go after their usual chores.
That's amazing. So do they have to be on blood thinners when you have this type of valve put in?
Fortunately not. So this valve, you don't need any blood thinner. You are in just a baby aspirin for 6 months, and that's all you need.
So this is made of tissue because it's from the cow, so it's not a mechanical valve where you need blood
That is
thinners
correct.
necessarily.
So other valves that exist are either made of some sort of metal or plastic, and then you need blood thinners to make sure you don't have any clots on that. because that's natural tissue, it does not happen. So just a little bit of aspirin is enough.
Great. And so what is the future of these valves? Going to be placing valves on the left side?
That's a very interesting question. So there have been some studies, and there have been some patients where this valve has been placed in the other 3 valves. We have 4 valves in the heart, and it's meant for the pulmonary valve, but now there are more and more patients that also benefit from this valve in other positions on the left side of the heart as well. In addition, the researchers and the companies are working hard to improve this valve and develop new valves that have even more sizes, so that you can place the valve in large individuals, small individuals.
Yeah, it's I mean, God was on your side that this came
Yes.
along at this time in your life.
Absolutely.
So we're just about out of time, but just tell us, what is your life like now? I mean, are you doing
Back to normal.
back to normal?
I'm back to work. I'm do pretty much what I want to do.
You can walk without any limitation.
Absolutely.
You don't run any marathons, I know that, but you can. But all the things that you enjoyed.
I don't either.
You don't neither do I. But all the things you enjoyed before,
Absolutely.
you can do now.
Yes.
And it's like, it's really a godsend, and it was
Yes.
amazing that the timing was just perfect for this to come. You be here, and you haven't been in the hospital since then, really.
I know. Amazing.
Knock on wood, huh?
Yeah, I'm not looking forward to going back.
No, thank you very much for coming, both of you. We appreciate it a lot.
Thank you. Thank you both.